breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Welcome back, everyone, to the last installment of Thyroid. We're brainstorming with Dr. Glenn and Dr. Kolby. Dr. Glenn Harrison, to jump right into it. In the last two episodes of the thyroid, we broke down what is thyroid disease, what are the various types of thyroid disease, how do you diagnose these specific conditions, and today we are going to talk about some interventions that we can implement that maybe increases the effectiveness of our treatments, or some strategies that people can use at home that maybe can help them manage some of their thyroid symptoms a little bit better. So we're going to jump right into it. So a question that we often get is, I have thyroid, my thyroid seems to be fine. My TSH is fine. My T4 is fine, but I'm still suffering from hypothyroid-like symptoms, whether I have fatigue, low energy, etc. Why don't we talk about a little bit where some of the breakdown happens from T4 to T3. T4 is the biologically inactive form of thyroid hormone, into T3, which is the type of hormone that our body actually uses. There's a couple different places in the body where that's degraded down. Why don't you go ahead and break it down for us a little bit?
Okay, Dr. Kolby. So this is where we're wrapping everything up. So if you're listening or watching this episode, it's kind of designed to build on the previous episodes where we talked about thyroid disorders, what they look like, how the thyroid functions, and then we went into further lab testing and how to identify if there's a thyroid problem. So this is kind of for the people that hopefully already if you have a thyroid problem. That's really what it is, the lab tests, or you work with your medical doctor or whatever. So as I mentioned, there's many systems in the thyroid. There's many pieces in the thyroid. The information comes from the brain. It stimulates your thyroid stimulating hormone. Your thyroid makes the T3 and T4. The T4 we can't use, the T3 we can use, and the thyroid makes very little T3. So we have to take T4 and convert it into T3. And it does this with a few different organ systems. So as you mentioned, Dr. Kolby, if you have a problem converting the T4, the inactive form, to the T3, there's those two organ systems. Your thyroid or your liver is responsible for about 60% of that conversion from T4 to T3. So when I see somebody coming in and we suspect a liver problem, okay, let's take a step back. So the liver converts some of the T4 to T3, but then the gut converts some of the T4 to the T3. And the gut is responsible for about 20% of that conversion. So the liver, it's about 60%, the gut is about 20%. So your question is, if someone has a problem converting T4 to T3, their lab panels would show sufficient T4 and reduced T3. Well, then, with a case workup and everything, and if I identified or it seemed like there's a thyroid or a liver problem, I would say that's the weak link. So then I would be looking into liver problems. Now I'm going to ask you, Dr. Kolby, from a presentation, if someone's listening at this, what would it look like for them if they had a liver problem? What symptom would they have, or what would they see in a blood work or anything?
You could look at their cholesterol levels. You could look at, what their bilirubin levels are like. Without getting too complicated, bilirubin, fats. You can look at, is the liver actually enlarged? You can do that with palpation, or you can do an ultrasound. You can look at inflammatory markers, all that kind of stuff. So that's how I kind of break it down. But like you said, looking at the thyroid the thyroid panel, determining if the T4 is normal and T3 is not normal, there's got to be a reason why it's not getting degraded.
Yeah.
Right?
So as you kind of went in the lab work of identifying if there's a liver problem, but what if someone's just looking in the mirror? Well, I know there's some skin issues
they can get like a yellow tint to their skin. They can get, that's like hypercholesterolemia is what it's called, which is just a big fancy word for saying that they have too much cholesterol. You can get like some itchiness actually. My good friend Levon actually has an issue with his liver. So he's got a bunch of like urticaria where he's itching all the time, and he's got some temperature intolerance and stuff like that too. So all those can be some of the physical manifestations of issues with the liver.
Okay, so that's what you see. And I've seen also jaundice of the eyes, so where the eyes have a yellow tinge. So any of those things would be simple presentations of a liver problem. So then we want to work on the liver. So if we want to work on the liver, well, we live in a world where there's all these toxins circulating in our environment. Foods can play a role into this. Pharmaceuticals play a role into this. Stress plays a role into it. If you can't sweat, your body's going to be more toxic. And then your liver has all this backed up toxins. So it's busy trying to clean out the toxins out of your body, and it doesn't have enough energy or resources to be able to convert thyroid hormone. So liver strategies, well, detoxification is one of the biggest things that you can do for your body. There's all sorts of supplementation, and, we'll have some links in here on detoxification supplementation, but we've got to be careful with detoxification because if we push too hard, we cause stress on the body and it can react. Even the products you use, you got to be very careful with liver products because there's some out there that are very potent. So there's supplement strategies, but you can't detoxify your body if you're eating crap food, right, Dr. Kolby?
Right. That's the part that I was going to kind of preach a little bit, is what you put in your mouth matters. I've said that again, or I've said that in previous episodes. If you're eating a diet that's really high in simple sugars, refined carbohydrates, or even things that are really high in saturated fats. If you're going to McDonald's, 2, 3, 4 times, in 2-3 days, that's too much. Your liver is not functioning well.
Yeah.
Exercise is another huge component that is definitely can be utilized to increase, the basal metabolic rate. That is, again, can help you sweat. So those are some strategies that we use for that. And again, supplementation, but only, we got to be careful with that. So.
Yeah, and cover your bases first. What you're putting in your mouth. So the liver is that big piece. It's converting 60% of your T4. The research changes a little bit. I know you know about this, Dr. Kolby. Converting it into T3. So we want to convert more of it into T3, the hormone that we can use. And then the other major organ system, if we can't convert T4 into T3, would be the gut. The gut's responsible for about 20% of this. So, I'll let you take this off. Dr. Kolby, what would someone sitting at home listening to this, watching this, what would a gut disorder qualify for that they could be compromising their thyroid conversion?
Sure. And this is something that I think I spoke to you about this after the last time when we were talking about what we were going to cover this week a little bit. When you think about gut stuff, it's like, okay, which came first? Was it the thyroid issue or was it the gut issue? Did they happen at the same time? There's no way of really knowing, but you do know that they're intertwined and they do affect each other. So when I look at people that might have an issue with their gut, I look at, the rate of their digestion. Are they, is their transit time slowed down? Does that, are they going to the restroom normally once, twice a day? Is it extended periods? Yeah, doc, I go to the bathroom like once every 3 days. Well, that's not normal, right? That's an increased transit time. That can show that the biome in your gut is not diverse, or maybe you don't have the right biome in there. You can look at, and it can go the other way too. I had diarrhea for 6 months. That's also not good. That can show malabsorption. You're not absorbing your nutrients. So you got to think, if you don't have this diverse, these diverse bugs in your gut that help you break down and absorb your food, you are not going to have the energy to actually, your cells in your gut are not going to have the energy to actually convert T4 to T3. You're not going to have, and this can actually play with the liver too, where, if you're not eating a diet that has enough fiber in it, that fiber helps to actually move cholesterol out, which can cause liver complications and stuff like that too. If you're not eating enough fiber, the cholesterol stays in there and it gets broken down. That's where you get, elevated LDLs, and you get elevated triglycerides and all that kind of stuff. So that everything plays together. And that's where you look at people who might have issues with the gut. You can have increased transit time, which is like constipation. You could have diarrhea. You could have extreme flatulence. You can have low energy. You can have abdominal distension. I mean, if you're having issues with your digestion and you have a thyroid issue, you better be looking at the gut, and you better be looking at improving digestion.
Yeah, for sure. And as you talked about the gut, if there is a problem with the gut and you're not getting the toxins out of your body, they leak into your bloodstream, and then your liver has to clean all that out. So if your gut's not working, you give another big toxic load to your liver, and then the liver and the gut aren't able to convert much at all of the T4 into T3, and then your labs will say, normal T4, or hopefully normal, and very low T3. So those are two areas of it. Now you gave a scenario of not being able to convert T4 into T3 as it being the weak link in the thyroid story. What if someone, and I'll ask you, Dr. Kolby, what would a strategy be if even the stimulation from the brain to the thyroid is low, like low TSH? What strategies would you look at there, or how would you approach it? Because you're always working with brains.
Sure. I mean, you just have to look at that hypothalamic pituitary axis. You know, I don't even know if I would go into it.
Yeah.
Because it's kind of like, it's really convoluted and complex. So let's just maybe not cover that.
not go into that.
But I think that one part that we definitely could cover with the neurology and stuff like that is you got to think of like exercise. Exercise basically prevents the release of good substances in your neurochemistry, and that can actually influence your your hypothalamus and stuff like that, because your hypothalamus is like in the brain at the top kind of, and it kind of is like the master hormone regulator. So without going in like too deep, it's what helps to basically set the tone for, reproductive hormones. It sets the tone for thyroid hormone. It sets the tone for basically everything. So I don't really want to go too.
But I guess to summarize, to keep it simple, in some cases, physical activity can stimulate the brain enough so it can produce that TSH hormone to start stimulating your thyroid.
Yeah, I mean, it's definitely not going to hurt. In fact, I use this on a patient that I had that had extreme depression. He was in like his early 70s. He came in. We ran a comprehensive workup on him, included thyroid, lipid profile, all this kind of stuff, urinary analysis. And when he came back, I'm like, oh, he's anemic, weird. And, the guy has a major thyroid thing. His depression, his anxiety. One of the basically ways that I gave him to manage this is I was like, all right, I want you to do really, really intense exercise within 10 to 15 minutes of waking up. And I want you to do like it as intervals. So I want you to do like, 5 minutes of interval training, a minute of sprints, a minute of walk, a minute of sprints, a minute of walk kind of thing. And the last I saw him last week, and I've been seeing him kind of not really as regularly, probably once every like 4 to 6 weeks. And he's like, it's the best I've ever felt. My energy's back, my vibrancy's back. I'm back in love with my wife, my depression, that kind of that was a huge part for me, right? Is that this guy had been married to his wife for, I think since he was 18, and he's like, I got to the point where I didn't want to even be around her. We weren't talking. It was totally miserable. We were just like coexisting, not really, having the fun stuff that you would expect in your golden years. We put him on some supplements, put him on an exercise protocol or plan, and put him on a dietary plan, and boom, good to go. So it is possible.
Nice. So are there any other weak links in the thyroid story, without going into too deep, that you would want to bring up?
Sure. I mean, if you have a true thyroid, because there are cases where there is true thyroid pathology where you're actually just not making enough thyroid hormone. If that's the case, that can be managed relatively well with, supplementation such as Armour or Synthroid, which are, there's bioidentical hormones to the thyroid, and then there's a synthetic thyroid hormone that can help for the treatment of hypothyroidism too. That being said, if it's a T4 hormone and you're not able to break it down into T3, not really going to do you a whole lot of good. So that's the importance of like really breaking down the whole thyroid physiology and kind of figuring out where your issues are.
Mm-hmm.
About you, anything else you want to cover today?
No, I think another thing is kind of what you were touching on when there is, the thyroid is just not performing regardless of conversion, liver, gut, any of that. But to definitely do not avoid being that individual that just wants to go only natural and stays away from all pharmaceuticals. I had a lady come in, I was just discussing the case with you. She came in and she was anti-medical. And I appreciate that. I can recognize that, but I can only appreciate it so much until people put it off for so long. And her TSH was through the roof. That meant that her brain was screaming at her thyroid, and her thyroid numbers, her T4 and T3, were both in the tank. They were low. So for the viewers, please do not dismiss, we talked about this last time, do not dismiss thyroid hormone, thyroid function, because it's not only weight, energy, aesthetics, and happiness. It is, and hair, it's about survival. This thyroid system isn't extra, and it's an extra part on the body. It actually keeps you alive. And this lady that just started on care, the first thing I told her, we ran all the labs. First thing I told her, she had, and I told you about this, Dr. Kolby, she had to go to a medical doctor to get medical intervention and pharmaceuticals, because what we're going to do is slow. We don't know how far we're going to be able to do it because she's in such a bad place. But pharmaceuticals are her friend in that case, and we'll follow it and make sure the medication or her numbers are within range and work with a prescribing doc. So I guess that's the only thing that I wanted to add. Don't dismiss it, and don't run away from your medical doctor with some of these things. It's not a matter of aesthetics or energy only. It's a matter of life, survival. Right.
And then the other part of it, I think, and we didn't touch on this, and I think that we probably should, is like, say that we've talked pretty much exclusively at hypothyroidism.
Mm-hmm.
The other extreme end of the spectrum would be Graves. If you have Graves' disease or you have hyperthyroidism, needs to be managed by a qualified medical professional, an endocrinologist, whatever. Go to your primary care physician. Make sure, because that is a big deal. Disease is a big deal.
Yeah, do not play around with that. That's where there's too much stimulation going to the thyroid, and it can come from the immune system or tumors or all sorts of different things in the brain, and that cannot be dismissed. By no means, that's serious stuff. So,
So I hope that everyone found this to be beneficial. We're going to cut it a little bit short today, I guess. We usually run about like 20 to 30 minutes. I think we've been going probably like 15 maybe.
So I think we're a little farther than that.
Are we? Well, good. So I hope everyone found this useful. I know that we've enjoyed breaking this down for everybody. If you or someone you love suffers from thyroid disorders, feel free to share the content with us or with them, or, drop a comment for us or get a hold of us, and we can answer any questions that maybe we didn't do a good enough job of, or if there's some concerns that everyone may have and it's a reoccurring theme, then maybe we'll add another portion to this where we address some of those concerns. As always, you can catch me on my Facebook page, which is North Lakes Chiropractic and Functional Neurology.com, or North Lakes Chiropractic and Functional Neurology on Facebook. Again, you can Google us, North Lakes Chiropractic and Functional Neurology. We're located in Grand Rapids, Minnesota. Dr. Glenn Harrison, he's located in Colorado. Why don't you drop your contact information for everybody?
Yeah, probably the best place is scope out the website. We have a lot of information there, or you can always email us or call us. But visit the website. All that information is there. That's the Center of Functional Medicine, www.drgharrison.com, or just Google the Center of Functional Medicine Denver. You'll find us, and you can always reach out to us with questions. We're going to elaborate on this. There's a lot of information in the show notes in the series. Highly recommend, if you are going to share the series, start from the beginning so everything makes sense as it goes through. But I had a blast, Dr. Kolby, to go through this, and as we strategize it, to try to make it in bite-sized pieces. There's a lot more to this whole thyroid story than what we're able to cram in these little webinars. But hopefully it gives people something they can sink their teeth into and realize they do not have to suffer with these symptoms if it's a thyroid. They can get past it if it's properly managed with natural strategies and conventional medical strategies.
Yep, I agree completely. So we will have to come up with the next topic. I don't know. We'll come up with something for you guys. If you guys have any ideas for topics that you'd like us to break down, please leave a comment, drop us an email, something, get a hold of us. We'll do our best. So until next time, man, have a great rest of your week, and I look forward to talking to you soon.
For sure. Thank you, Dr. Kolby. Same with you.